Hi, today let's go through the difference between CoolSculpting and Liposuction. CoolSculpting is a brand name for a technology, cryolipolysis. It comes from a company called Zelti. It's a US FDA approved non-surgical technique for weight reduction, or rather reducing fat from definite areas. Liposuction, on the other hand, is a surgical technique. So who benefits from CoolSculpting? Let's say someone's ideal body weight is 50 kilos. If they are 55 kilos or 57 kilos and they have small bulge at their love handles or under their gluteal folds or bra rolls, then they become the ideal candidate for CoolSculpting. Each cycle in CoolSculpting takes around 30 to 35 minutes, and so we can do about 4 cycles per day. And sometimes we also, depending on the thickness of the flap, patients may require 1 cycle for a flap or 2 cycles for a flap. What actually happens during this technique is that the fat freezes, so the temperature that fat can withstand is much lower than the skin. For example, let's say we are freezing the flap or the fold of skin to minus 6 degrees centigrade. What happens is that the fat actually dies, sparing the skin. Now, the CoolSculpting machine from Zeltec specifically comes with a safety device. That is, if the skin shows extensive cooling or there is impending evidence of frostbite happening, then automatically the machine shuts down. So there is no side effects. It is a day procedure, or it's just walk in and walk out. Depending on the number of areas, there will be a minimal pain or discomfort for a period of 3 to 4 weeks. So the fat cells that die because of cryolipolysis is then absorbed by a process called apoptosis and is excreted in the urine. So the client is advised to take plenty of water for the next 4 to 6 weeks, and the result is evident in about 4 to 6 weeks. Rarely, sometimes you might get bruise when we do double cycles in the same area, which actually disappears or goes away in about 3 to 4 weeks. Now, liposuction, on the other hand, is a surgical technique. Very limited areas, it can be done under local anesthesia, but that will involve multiple small tiny injections and infiltration of a tumescent fluid, and then small cannula is introduced and the fat is aspirated. Now, the advantage of liposuction is that the actual fat cells are being sucked out. So in one session for a definite area, the result expected after liposuction is about 60 to 70% reduction in that area. Whereas in CoolSculpting, you can expect in one cycle about 20% reduction. So you can imagine, to get to the result of liposuction, you might have to do 2 or 3 cycles. But if a patient has marginal overweight, definitely the same result can be achieved through multiple sessions along with lifestyle modification, but only for a person who is marginally overweight. Whereas liposuction, about patients who are overweight but does not fall under the category of obesity, then they become candidates for bariatric surgery. Those clients become the ideal candidates for liposuction. Liposuction will show definite results in about 3 to 4 weeks time. There will be edema for the first 2 weeks, or swelling in the area where liposuction is done. Then the edema gradually starts to settle down from 2 weeks onwards, when the result becomes slowly evident, and the best result, we say, is seen in about 3 months time. That is with all skin contraction, tightening, etc. Now, during this period, the client is advised to wear a compression garment, so that after the removal of fat, the remaining skin redrapes to that area. Since liposuction is a surgical technique, complications associated rarely with anesthesia have to be explained, and we do explain to all the clients. As far as the surgery is concerned, patient, there is a downtime. They need to take off from work for about 5 days or 7 days or 10 days, depending on the number of areas that is liposucked. For CoolSculpting, the client need not take off from work or gym or any routine activity. For liposuction, definite downtime and recovery period should be expected. So the client would have some bruise, numbness, or a little bit of contour deformities for a period of 4 to 6 weeks. Most of these will completely settle in about 4 to 6 weeks time.